TB Proof was founded in 2012 by South African healthcare workers and students after multiple personal experiences with occupational tuberculosis, particularly multi-drug resistant TB.
Many healthcare workers completely underestimate their risk of acquiring TB, and it's only in the last couple of years that published research has shown South African healthcare workers are up to 6 times more likely to develop drug-resistant TB than the patients they serve.
Tuberculosis is a chronic infectious disease that usually affects the lungs. TB is mainly spread when someone with TB coughs or sneezes and someone else breathes in the airborne bacteria.
I became ill in September of 2010 and initially was just diagnosed as having a pneumonia and put onto antibiotics. But by December, when I started with night sweats, I became alarmed and took myself off for another chest x-ray and a skin test. The skin test came up positive and the x-rays were also positive for TB, which came as quite a shock to me. I'd never in a million years expected to have a diagnosis like that.
The TB disease rate among health workers in South African public health facilities is up to 3 times higher than that of the general population, a recent study has revealed.
The loss of my profession has meant a lot more to me because I've just lost all I lived for. I loved my nursing.
Tilian van Delft was very fortunate to get compassionate access to a new drug. But up until 2013, only 4 people had been granted this drug outside trial conditions.
So when I was trained as a medical student, there was not a specific focus on TB infection prevention and control. And after my year working as a community service doctor, I unfortunately contracted what we call multi-drug resistant tuberculosis. And thus started a long journey. I had to take very toxic treatment, 7 different drugs, including daily intravenous injections for 18 months. And unfortunately, already 2 months into the therapy, I started experiencing one of the irreversible side effects of the treatment, that's hearing loss. I was very lucky. Through our country's compassionate use program, I managed to access one of the first new TB drugs in more than 40 years. And after taking this drug together with the other drugs, managed to get cured and managed to still preserve some of my hearing so I can practice as a doctor again today. So I saw the need to basically spread the word that healthcare workers should protect themselves against this life-threatening disease. And together with colleagues that was also either indirectly or directly affected by tuberculosis, we started this group with the main aim to train health science students on how to protect themselves.
In 2012, South Africa diagnosed about 14,000 MDR TB cases, but only half were ever treated. The country only has enough hospital beds to accommodate less than half of those diagnosed.
When a medical professional contracts TB, everyone immediately asks, what's wrong with them? Why did they contract TB? What's wrong with their immune system? And I think TB Proof's message is anyone can contract TB. Healthcare workers really need to realize they form part of a very high-risk group and they need to adequately protect themselves.
The way we divide protecting yourself against TB, there's administrative control, there's environmental control, and then there's the personal protective equipment. So in terms of administrative control and environmental control, there's not much that students can do, but what they can do is they can advocate and they can question and they can say, why is this patient who has TB not being isolated? Why is this patient lying in the same ward as other patients? In terms of personal protection, students should know how to use the N95 respirator that they should wear, and they should wear that when working in the clinical environment to protect themselves from contracting TB.
As TB Proof, one of the goals that we strive towards is having prevention policies put in place at all institutions where health science students are trained. That means a clear policy with regards to how students are to be protected and what is to happen of those that actually contract tuberculosis in the course of their studies.
TB Proof aims to protect colleagues, students and patients by creating greater awareness of and protection against occupational and nosocomial TB transmission through education and activism.
So what the government can do, I think, is support compassionate use programs for the use of new drugs that are still in development and make it available to patients in dire need under controlled circumstances. What we also would like to see is policies on infection prevention and control for all health facilities and for all healthcare workers.
My first message to healthcare workers is to look after your own health. And importantly, to know your own HIV status, because HIV is the single most important risk factor for acquiring TB. And then take precautions. Suspect the possibility of TB in every patient you see, because it is such a common diagnosis that we are dealing with on a daily basis. And then make sure that your environment is safe. And then also use protection. So what is available is something called an N95 respirator. It's a very effective, essentially a mask that filters the air that you breathe and essentially removes all TB bacilli that go into your lungs.
It's frightening that our doctors, nurses and therapists face this daily threat to their health, and yet they choose to continue helping us all remain healthy and free from disease.
Healthcare workers should protect themselves against getting tuberculosis, because if we lose our healthcare workers, in the end, we'll lose our workforce that's in dire need. Also, if healthcare workers get tuberculosis, they can spread it to the patients that come to the hospitals. Our hospitals should be places of healing, but unfortunately currently it's places of contagion.